Well, welcome to our little discussion on the cause of Alzheimer's disease. Good to have you. If you're experiencing memory loss or a loved one is, I think this is an important topic, something that would help you make decisions and understand what's happening. So we're happy to do it for you. By the way, my name is Dr. Jim McKinney. Have been at MCV for 30 years and conducted clinical research there. In 1995, I brought the company private and called it National Clinical Research. So I'm now president and CEO of National Clinical Research and recognized still as a professor emeritus with MCV VCU. Okay, the causes of Alzheimer's disease. Whenever a patient is seen by a neurologist or a primary care physician, others who deal with this, and the issue is memory loss, in the vast majority of cases, patients are going to have memory loss due to Alzheimer's disease. But I want you just to be aware that there are a smaller number of people who have memory loss from causes other than Alzheimer's. And you'll understand when I finish what Alzheimer's means. Frontotemporal dementia can affect patients with memory loss. It's usually a little bit earlier, usually more of a behavioral change, but nonetheless some memory loss. Vascular dementia or vascular memory loss refers to strokes and other injuries to the brain caused by strokes or mini strokes, TIAs they call them. Traumatic brain injury is self-explanatory, but it includes a lot of people actually. Automobile accidents with severe head injury, concussions from playing too much football and getting hit, soldiers coming back from war. Later in their life they may have memory loss due to that earlier traumatic event. And finally, Parkinson's disease, near the end of the course of that disease, there's a memory loss that looks like just like Alzheimer's disease. So anyway, just to let you know, there are some causes that we're not going to be addressing today. It is Alzheimer's disease. While I'm here, let me just say this too, that the word dementia means memory loss and vice versa. I use them interchangeably. They may have an inference of difference, but I think they are used generally interchangeably in nomenclature. Let's start at the very beginning with Alzheimer's disease. This is Auguste Deter, the very first patient known to have had Alzheimer's disease in the world. This is in the mid-1880s. She was experiencing memory loss by 1901. Her husband could no longer take care of her because her memory loss was quite severe. She was having delusions. She was having difficulty sleeping. She needed help. And so she was admitted to the mental hospital in Frankfurt, Germany, and said to her physicians, very interestingly, "I've lost myself." Her physician was Dr. Alzheimer's, who at the time, he was a psychiatrist. He dealt with mental illnesses. Interestingly, as he saw Auguste Deter, his conclusion was she didn't have a mental illness. He guessed she had a functional medical problem due to some cause that could be discovered, some physical cause. And he actually was right in that. He didn't know, however, what it was. He'd never seen anything like this before. None of his colleagues had. He called it a disease of forgetfulness. In 1906, at age 51, Auguste Deter died. Now, I want you to know that she had a very unusual, rare, powerfully inherited form of Alzheimer's. There are such rare instances today where individuals are affected in their early 40s, and by their early 50s they've passed on. But the disease, Alzheimer's, is the same whether it's one of the more severe and rare kinds I'm talking to you now about, or the ones that affect the majority of us later in years. Dr. Alzheimer's examined tissues of her brain and there saw what he called plaques and tangles. He had no idea whether there was a connection, but he was suspicious and wrote it down, lectured about it, and now we're all looking at plaques and tangles for the treatments that we're trying to develop. This is what he may have seen, a stain of a section of a brain with Alzheimer's, a patient with Alzheimer's disease. And there you see plaques where the arrows are pointing, sort of little clumps of, turns out, clumps of protein. And we'll talk about that in more detail. The tangles, you see where the arrows are pointing, looks like little triangles. It turns out they're tangles of tissue that, again, tells us something about the course of this disease, and I'll talk to you about that. So let's go to the anatomy. This is a brain cell. You notice that there's a central nucleus, and then off from that, from the same cell, tentacles or tubules, however you want to describe. There could be many, could be as many as 100 coming off of that one cell, or like 6 or so. And then you see in that picture firing, and what is depicted there is where the end of one tubule meets the end of the tubule of another adjacent brain cell. And what is happening is the brain cells are communicating. They're sending signals out, electrical signals that are passed from one brain cell to another. And that's how we think. That's how we reason. That's how we remember. That's how we smell. That's how we see. All the things about our personality is controlled through that process. Even the things we can't control, like the heart, the beat of our heart, the movement of our lungs, the movement of our intestinal tract, how to swallow and when to swallow. These things are controlled by this very intricate interconnectivity between neurons or brain cells and the signaling that they are passing on one to the other. Now, enter a culprit to this beautiful creation. It's called amyloid beta protein. Amyloid protein is made naturally in the brain. There's a function for it. There's a place for it. So it's not unusual. It's not odd to see it there. The odd thing is that amyloid protein becomes sticky in some people late in life, and they can stick together, falling clumps of this protein or globs, or what Dr. Alzheimer's called plaques. And these can form all over the brain, eventually covering good portions of it. And as it does, you can imagine it disrupts the normal functioning of this brain cell. Especially the signaling between brain cells could be disrupted. And with time, probably over many years, the brain cell actually becomes, I guess, to the point where it can't function very well. I'm going to tell you about that in just a moment. So the first insult, and the one we think that starts this disease, are these plaques of amyloid protein. These are called neurotoxic. Neuro meaning brain cell or neuron, toxic, of course, meaning bad. So until very recently, about 8 to 9 years ago, we could not tell who had plaque. There was no blood test, no physical exam. We just guessed. And if they had plaque, we would say they had Alzheimer's disease, but we were guessing. Since the last 9 years, we actually have a scan, a PET scan of the brain that shows up with different colors if there is plaque. So in this example, to the left, you see red, which means high concentrations of this plaque, and yellow, which means presence of the plaque, but not as high concentration. And that person has a positive PET scan for amyloid plaque and is said to have Alzheimer's disease if they have memory loss in addition. The person on the right, you see there's no such thing, and they have no evidence of amyloid plaque. So let's advance the story a little bit. This is also a brain cell we've just looked at before. Now I've named these tubules as dendrites. Those are the microfibers and tubules through which the brain cell receives signals from other brain cells, and the axon through which it communicates to other brain cells. And along that axon is another protein called the tau, or the tau, depending how you want to pronounce it, protein. Strips of it, layered one after the other, back to back, side by side, line the other circumference of the axon, giving it structure, rigidity. It's like an exoskeleton, and functions very nicely until plaques are laid down and begin to cause this brain cell to deteriorate, to degenerate, and to basically fall apart. And when that does, you have a rupture of the plaque, the tau protein. It strips off from the axon. It ravels around each other, tangles around each other, and that's what Dr. Alzheimer's was seeing, and it's called tangles. And the microtubules that send signals from the brain inside of that axon now is disjointed and no longer functional. Eventually, this brain cell will die, and others like it will die. And that really is what's causing the disease. When this tangle starts, that is when the memory loss itself starts. And as of a couple of years ago, we now have a PET scan that can also look for tau. On the left side, you see little or no evidence of amyloid or tau. On the right side, you see there's evidence of both. So this person not only has the amyloid, which is the initial insult, but now has evidence of tau protein, meaning there's tangles, the brain cell is becoming dysfunctional and dying. So what we've just talked about is the sequence in which Alzheimer's starts. The plaque is there, it's called amyloid beta. The tangles follow that, usually some numbers of years later, and that signals the beginning of the breakdown of the cells. And then soon thereafter, or concurrent, the patient is going to have some memory loss that we begin to measure, and the longer you go, the more tangles, the more memory loss is experienced. So this is an interesting slide, and it helps us understand the time course. If you look at the sort of blue, let me first of all tell you, across the horizontal axis, we're looking at years. The vertical axis, we're looking from normal at the bottom to abnormal at the top. So the blue line you see demarcates the amyloid plaque and how it accumulates over time. So 10 to 20 years before the patient has any memory loss at all, this is building up. All of us, any of us, could have this buildup of amyloid plaque and not know it because we don't have symptoms yet. The next important thing that happens, you see in the orange curve, and that is the buildup, accumulation of tau. That's when the cells are beginning to breaking down, degenerating, and dying. And you see that also comes without symptoms until a little bit later. The yellow line now shows you the memory loss that we can begin to measure. And you see the dotted line, the vertical dotted line, the second one demarcates when that measurement is possible of memory loss. And it progresses from mild to moderate to severe memory loss as the disease progresses and gets worsened. Look at the very bottom there, you see that the average time the person survives from the point of memory loss being detectable to their death is 7 to 10 years on average. It could be higher, it could be 15 or more years, it could be lower, it could be 4 or 5 years. So it gives you some ideas, but the key is that this plaque is laid down many, many years, probably decades before the first symptom. So here's a medical textbook definition of Alzheimer's disease. It is a progressive, irreversible, degenerative brain disease that causes the deterioration of brain cells and ultimately cell death. So, in my own words, Alzheimer's disease causes the progressive loss of brain cells. If you're losing brain cells, you now don't have the capacity to remember recent things. You can't remember yesterday. You can't remember the names of people that you just met yesterday. You begin to forget how to get yourself, driving yourself around town. You forget how to take care of paying your bills. You read a book and you have to read it again and read it again because you can't keep track of it, because the cells you need to hang on to that memory are now either dysfunctional or actually absent. And this is the most vivid description of what is happening. A brain scan of the brain, you can see the person with Alzheimer's disease has visibly and measurably smaller brain because they have lost so many brain cells. At this point, the loss would be millions to cause that much difference in the size. And so it gives you just a very nice understanding of what this horrible disease really is. So there it is, a bit of a description of the cause. I hope it's been helpful to you. Now, I've also put in a lecture on the treatment. You'll find that under our Alzheimer's studies, if you wish to listen to it. We also have on the website a really nice and interesting hour-long NOVA program on Alzheimer's disease, I recommend that to you. Let us hear from you. If you're experiencing any problems with your memory or your loved one is, give us a call, check out our website, send an interest form in, make an appointment. We'll be glad to sit down and see how you're doing.